Welcome to this new meeting. Today we will see the palpation of the muscles of the anterior aspect of the thigh, the medial aspect of the thigh, and the lateral aspect of the leg. The first muscle that we will feel is the tensor fasciae latae, which we find at the level of the hip joint. This muscle is inserted into the fascia latae, which is a connective structure that follows the entire lateral region of the thigh down to the level of the tibia and the fibula. Returning to the level of the pelvis, we have the most superficial muscle of the anterior aspect of the thigh, that is the sartorius. Its tendon, and then I follow the path of the belly that from the lateral becomes medial to end in the superomedial surface of the tibia at this height. This will be one of the tendons that will make up the pes anserinus. At pelvic height, the most lateral muscle we find is deep and is the pectineus muscle. I move moderately and find the adductor brevis, the adductor longus. Deeper between the gracilis, which is the muscle just below, I find the adductor magnus. And then the most medial muscle is the gracilis. I follow this muscle because the tendon will also insert to the medial tibial plateau and will also be one of the tendons that form the pes anserinus.